Every 3 seconds, someone in the world begins losing a piece of their memory. By the time this video ends, hundreds more families will start a journey they never wanted to face. And here's the frightening part. It may not begin with age alone. It may begin with the very pills sitting on your kitchen counter. Millions of older adults take prescription medications every single day. Most are necessary. Many improve quality of life. But some of the most common medications prescribed after age 60 may quietly interfere with the way your brain forms memories, processes information, and stays sharp. You may never notice it at first. A forgotten name, a missed appointment, walking into a room and wondering why. It feels harmless until it isn't. In my years treating older adults, I've seen families blame themselves for memory changes that were actually made worse by medications no one thought to question. That doesn't mean the medicines were bad. In many cases, they were the right treatment. But understanding their possible effects made all the difference. So before we go any further, I'd love to hear from you. How old are you today? And how many prescription medications do you take each day? Share your answer in the comments. I read as many of them as I can, and your experience may help someone else realize they're not alone. Now, here's what surprised even me. Several of the medications on today's list are prescribed to millions of Americans every year. Some are found in nearly every neighborhood pharmacy. Most people would never imagine they could affect memory. Yet recent research suggests that, for certain older adults, they may contribute to confusion, slower thinking, or problems recalling everyday information. But please hear this carefully. Do not stop taking any medication because of this video. Many of these drugs save lives and remain the best option for countless people. The goal today is not fear, it's awareness. The right conversation with your doctor could help protect both your health and your memory. And one medication, the one we'll reveal at the very end, continues to surprise patients, caregivers, and even experienced clinicians because its connection to memory is so often overlooked. You won't want to miss that one. Let's begin. Memory doesn't usually disappear overnight. It fades quietly. So quietly that many people mistake the warning signs for just getting older. That is one of the biggest misconceptions I've encountered throughout my career. I've met patients who assumed they were developing dementia because they kept losing their keys. Others became frightened after forgetting conversations with their grandchildren. Some even began withdrawing from family gatherings because they were embarrassed by simple memory slips. But here's what many people never realize. Not every memory problem begins inside the brain itself. Sometimes, the brain is reacting to something else. Imagine your brain as the control center of your entire body. Every thought, every memory, every decision depends on billions of nerve cells sending tiny electrical messages back and forth. Those messages rely on the right balance of oxygen, nutrients, blood flow, and chemical messengers called neurotransmitters. When that balance is disturbed, the brain has to work harder. Even small changes can matter. Some medications can reduce the activity of certain brain chemicals. Others may make you feel sleepy, slow your reaction time, reduce blood flow, or interfere with the deep sleep your brain needs to organize memories from the day. None of this means the medication is harmful for everyone. In fact, many of these medicines are extremely effective and absolutely necessary when used appropriately. Context is everything. The challenge is that our bodies change as we grow older. The liver and kidneys may process medications more slowly. Body composition changes. The brain becomes more sensitive to certain drugs than it was decades earlier. As a result, a dose that caused no problems at age 45 may have a very different effect at age 75. That surprised many of my patients. One gentleman I'll call Robert came to see me shortly after his 79th birthday. He was convinced his memory was failing. His wife noticed he repeated questions, forgot recent conversations, and seemed unusually tired throughout the day. They feared the worst. After carefully reviewing his medications, we discovered that several of them could affect alertness and memory when taken together. His healthcare team adjusted his treatment plan, monitored him closely, and over the following weeks, his thinking became noticeably clearer. He wasn't cured, because aging still affects the brain, but the improvement gave him confidence, independence, and hope. Stories like Robert's remind us of something important. Never assume. Memory changes deserve attention, but they also deserve investigation. Sometimes the cause is a medical condition. Sometimes it's poor sleep. Sometimes it's dehydration. And sometimes medications are part of the picture. That's why this conversation matters so much. As we count down today's list, you'll discover why some medications can influence memory, which warning signs are worth discussing with your doctor, and what questions may help you make safer, more informed decisions. You may recognize one or two medications immediately, or you may be completely surprised. Either way, each item builds on the last, and the final medication is the one I most hope you'll remember because it's often hiding in plain sight. Let's start the countdown. Number. Number 9. Certain sleep medications. It sounds almost impossible. A medication designed to help you sleep may be making it harder for your brain to remember. That seems unfair. After all, good sleep is one of the best ways to protect memory. During deep sleep, your brain sorts through the day's experiences, strengthens important memories, and clears away waste products that build up over time. Think of it as your brain's overnight housekeeping crew. But here's where the story changes. Some prescription sleep medications can help people fall asleep more quickly, yet they may also reduce alertness the next morning or interfere with the brain's normal memory processes in certain older adults. The risk is not the same for everyone, but it tends to increase with age because the body often breaks down these medications more slowly. Recent research suggests that some sedative sleep medicines, particularly when used regularly or over long periods, may be associated with memory problems, daytime confusion, falls, and reduced mental sharpness in older adults. This is one reason many geriatric specialists encourage reviewing these medications periodically, rather than assuming they should be taken indefinitely. The details matter. I remember a patient I'll call Margaret. She was 81 years old and had begun forgetting little things every morning. She misplaced her glasses almost daily. She couldn't remember whether she had taken her blood pressure medicine. She started writing notes for everything because she no longer trusted her memory. Her family feared dementia, but after a careful medication review with her physician, they discovered she had been taking the same prescription sleep medication every night for several years. Her healthcare team gradually adjusted her treatment plan and introduced healthier sleep habits. Over the following months, Margaret became more alert during the day, and many of those frightening memory lapses became far less frequent. Her confidence returned. That doesn't mean the medication was bad. For some people, prescription sleep medications are the right choice, especially during short periods of severe insomnia. The important question is whether the benefits still outweigh the risks months or even years later. That's a conversation worth having. If you take a medication to help you sleep, ask your doctor questions such as, is this still the best option for me? Am I taking the lowest effective dose? Are there non-drug approaches that could improve my sleep? Never stop a sleep medication suddenly without medical guidance, because doing so can sometimes lead to withdrawal symptoms or a rebound of severe insomnia. The good news is that many sleep problems can improve with a combination of lifestyle changes, better sleep routines, and, when appropriate, carefully adjusted treatment plans developed with your healthcare provider. There is hope. And the next medication on our list is even more surprising, because millions of people take it for something they would never expect to affect the brain. Let's move on to number 8. Number 8. Certain bladder medications. At first, the connection makes no sense. A medication for your bladder? Affecting your memory? How could that happen? Yet this is one of the most overlooked conversations in senior healthcare. Many medications used to treat an overactive bladder work by calming the muscles that cause sudden urges to urinate. For many people, these medicines provide real relief. They can reduce accidents, improve sleep, and restore confidence to leave the house again. Those benefits are important. But some of these medications belong to a group that can also affect a brain chemical called acetylcholine. Think of acetylcholine as one of your brain's most important messengers. It helps nerve cells communicate with one another. It's involved in learning, attention, and forming new memories. When too much of that signal is blocked, the brain may struggle to keep up, especially in older adults. As we age, our brains naturally produce less of certain chemical messengers. That means even a small additional reduction from medication may have a greater effect than it would in a younger person. Some people notice mild forgetfulness. Others feel unusually sleepy, confused, or have trouble concentrating. Not everyone experiences these effects, but they deserve attention. Several studies over the past decade have found that long-term exposure to medications with strong anticholinergic effects may be associated with a higher risk of cognitive decline in some older adults. Researchers continue to study exactly how strong this relationship is, but many geriatric specialists now recommend regularly reviewing these medications, especially when they are used for extended periods. That shift is significant. One of my patients, whom I'll call Helen, was 77 and loved spending afternoons reading mystery novels. Then something changed. She found herself reading the same page 2 or 3 times because she couldn't remember what she had just read. She worried that her mind was slipping away. Her family worried too. When we reviewed her health history, we noticed she had started a medication for bladder urgency several months earlier. Her physician carefully evaluated her treatment plan and discussed alternative options that were more suitable for her situation. Over time, Helen noticed she could focus more easily again. She wasn't suddenly 20 years younger, but she felt more like herself. That made all the difference. If you're taking medication for an overactive bladder, don't stop it on your own. Instead, ask your healthcare provider questions like, could this medication affect my thinking or memory? Are there newer treatments with a lower risk of cognitive side effects? Would pelvic floor exercises, bladder training, or other approaches help alongside my medication? Those simple questions can open the door to a better treatment plan. The good news is that many people can successfully manage bladder symptoms while also protecting their brain health. The best solution depends on your overall health, your other medications, and your personal goals. There are often options, and the next medication on our list is found in medicine cabinets across the country. Most people take it without ever imagining it could influence the way they think. Number 7 may surprise you even more. Number 7. Certain allergy medications. This one catches many people off guard. It's an allergy pill. How could it affect your memory? The answer depends on which allergy medication you're taking. Seasonal allergies can be miserable. Constant sneezing, watery eyes, a runny nose that never seems to stop. It's no surprise that millions of older adults reach for allergy relief every year. Many newer allergy medications are designed to cause little or no drowsiness, but not all of them. Some older antihistamines can cross into the brain and block a chemical messenger called acetylcholine, the same messenger we discussed a moment ago. When that happens, the medication doesn't just dry up a runny nose. In some older adults, it may also slow thinking, reduce alertness, and make it more difficult to form new memories. The effect can be subtle. You may feel a little foggy, a little slower. You might blame poor sleep, or aging, or simply having a busy day. But the medication may be playing a role. As we grow older, our brains become more sensitive to medicines with these anticholinergic effects. At the same time, the body often clears drugs more slowly than it did decades earlier. That means the medication can stay in the system longer, increasing the chance of unwanted side effects. Even a familiar pill deserves a second look. Research over the past several years has raised concerns about the long-term use of medications with strong anticholinergic properties in older adults. While researchers are still studying cause and effect, many medical organizations now encourage healthcare providers to review these medications carefully, especially if memory problems begin appearing without another obvious explanation. That's an important shift. I think of a patient I'll call James. He was 76 and prided himself on never missing his weekly bridge game. Then he began forgetting the rules he had known for years. He misplaced cards, lost track of conversations, and felt unusually sleepy in the afternoon. His family feared the beginning of dementia. The answer turned out to be much simpler. James had been taking an older allergy medication almost every day to control year-round symptoms. After discussing the situation with his physician, they switched him to a treatment that better matched his needs. Within a few weeks, his daytime drowsiness improved, and his concentration became noticeably sharper. His confidence came back. That doesn't mean every allergy medication is risky. Far from it. Many newer antihistamines are considered much less likely to affect thinking because they enter the brain far less readily. The key is knowing which medication you're taking and whether it's still the best choice for you. Knowledge is powerful. If you rely on allergy medicine, ask your healthcare provider or pharmacist. Is this an older antihistamine? Could it affect my memory or increase my risk of falls? Is there a newer option that may work just as well with fewer effects on my brain? Those questions could make a meaningful difference. The good news is that many people find effective allergy relief without sacrificing mental clarity. Sometimes, a small change in treatment is all it takes to breathe easier and think more clearly. But don't get too comfortable. The next medication isn't taken for allergies or bladder problems. In fact, many people take it every single day to protect their heart. And that's where the story becomes even more unexpected. Number 6. Certain beta blockers. This one often surprises people. How could a medication that helps protect your heart have anything to do with your memory? It's a fair question. Beta blockers have been used for decades to treat conditions such as high blood pressure, irregular heart rhythms, chest pain, and after a heart attack. For millions of people, these medications are life-saving. They reduce the workload on the heart, help control dangerous rhythms, and lower the risk of serious cardiovascular events. Those are remarkable benefits. But not every beta blocker behaves the same way. Some are more likely than others to enter the brain. In certain older adults, that can contribute to side effects such as unusual fatigue, vivid dreams, difficulty concentrating, or a feeling that thinking has become just a little slower. The change is often gradual, so gradual that many people never connect the dots. Imagine your brain as a city powered by electricity. Every memory, every conversation, every decision depends on millions of signals traveling smoothly from one nerve cell to another. If those signals become slightly less efficient, or if you're constantly feeling tired because of a medication's effects, you may notice that your mind simply doesn't feel as sharp as it once did. Not because you're losing your intelligence, because your brain is working under different conditions. Recent research suggests that while beta blockers are not generally considered a major cause of dementia, certain individuals may experience cognitive side effects depending on the specific medication, the dose, their overall health, and other medicines they are taking. That's why doctors look at the whole picture rather than blaming a single prescription. Every patient is different. I remember a gentleman I'll call Thomas. He had just turned 80. He told me, "Doctor, I don't feel confused. I just don't feel like myself." He wasn't forgetting the names of his grandchildren. Instead, he struggled to follow conversations during family dinners. By evening, he felt mentally drained. Reading the newspaper had become surprisingly difficult because he found himself rereading the same paragraphs. His heart was doing well. His mind was not. After reviewing his medications, his cardiologist determined that another beta blocker might provide the same heart protection with fewer side effects for Thomas. The change was made carefully, and over the following weeks he noticed more energy and better concentration. His heart remained protected, and his confidence improved. Stories like Thomas's remind us of an important lesson. Never assume that feeling mentally foggy is simply part of getting older. Sometimes it's the result of several small factors working together: medications, sleep, hydration, hearing loss, stress, or another medical condition. Finding the cause matters. If you take a beta blocker, don't stop taking it because of something you've heard online. Suddenly stopping these medications can be dangerous and may lead to serious heart problems. Instead, have a conversation with your healthcare provider. You might ask, could this specific beta blocker be contributing to my fatigue or mental fog? Is my current dose still appropriate for my age and overall health? Would another medication provide the same heart benefits with fewer cognitive side effects in my situation? Those questions can lead to a thoughtful discussion without putting your heart at risk. The good news is that for most people, the cardiovascular benefits of beta blockers greatly outweigh the risks. The goal isn't to fear these medications. It's to make sure you're taking the right one at the right dose for the right reasons. That's what good medicine is all about. But the next medication on our list is even more common. In fact, many people take it for something as ordinary as stomach discomfort, and few suspect it could have an indirect effect on brain health over time. Number 5. Certain acid reflux medications. This one surprises almost everyone. It's a medication for heartburn, not your brain. So how could the two possibly be connected? Acid reflux medications called proton pump inhibitors, often shortened to PPIs, have helped millions of people find relief from painful heartburn and protect the stomach from ulcers. For many patients, they are the right treatment. They can even prevent life-threatening bleeding in certain situations. Their benefits are real, but problems can arise when these medications are taken much longer than necessary without regular review. Here's why. Your stomach acid does more than cause heartburn. It also helps your body absorb important nutrients. Among the most important is vitamin B12, a nutrient your brain and nervous system rely on to function properly. Think of vitamin B12 as part of your brain's maintenance crew. Without enough of it, nerve cells may not communicate as efficiently. Over time, some people can develop symptoms such as forgetfulness, poor concentration, tingling in the hands or feet, fatigue, or even difficulty with balance. The connection isn't immediate. It develops quietly. Research has found that long-term use of proton pump inhibitors may increase the risk of vitamin B12 deficiency in some people, particularly older adults. Scientists have also explored possible links between prolonged PPI use and cognitive decline, but the evidence has been mixed. At this point, experts generally agree that more research is needed. while also emphasizing the importance of using these medications only when medically appropriate and reviewing them regularly. That's an important distinction. The medication itself may not be directly harming the brain. Instead, in some individuals, it may contribute to conditions that can eventually affect brain function if left unrecognized. I remember a patient I'll call Linda. She was 78 and had taken medication for acid reflux for many years. Gradually, she noticed she tired more easily. Crossword puzzles that had once been relaxing became frustrating. She often lost her train of thought in the middle of conversations. She blamed getting older. Her doctor decided to take a closer look. Blood tests revealed that Linda's vitamin B12 level had become quite low. After discussing her treatment plan, her physician addressed the deficiency, reviewed whether she still needed long-term acid reflux medication, and monitored her progress carefully. Over the next several months, Linda's energy improved. So did her confidence. Her story illustrates a lesson I wish more people understood. Sometimes it's not the prescription itself, it's what the prescription changes inside your body over time. That's why regular follow-up appointments matter so much, especially if you've been taking the same medication for years. If you use medication for acid reflux, consider asking your healthcare provider, do I still need this medication? Should my vitamin B12 or other nutrient levels be checked? Could I manage my symptoms with a lower dose or a different treatment plan? Never stop these medications abruptly without medical advice, especially if you've been taking them for a long time. In some cases, symptoms can return suddenly and become even more uncomfortable. There may be a better approach. Sometimes simple changes such as avoiding late-night meals, maintaining a healthy weight, limiting trigger foods, or raising the head of the bed can reduce reflux symptoms alongside medical treatment. Your healthcare provider can help determine what combination is safest and most effective for you. The good news is that awareness gives you options. A simple conversation today could prevent problems years from now. But the next medication on our list is in an entirely different category. It's prescribed to reduce inflammation and calm an overactive immune system. And when it affects the brain, the changes can happen much faster than many people expect. Number 4. Corticosteroids. This one can happen faster than you think, sometimes in days, not years. Corticosteroids, often simply called steroids, are powerful medications used to reduce inflammation. They can be life-saving for conditions like severe asthma, autoimmune diseases, allergic reactions, and certain types of arthritis. For many older adults, they make it possible to breathe easier, move with less pain, and avoid serious complications. They can be extraordinary medicines, but they also deserve respect. Unlike some of the medications we've discussed so far, certain corticosteroids can affect the brain relatively quickly, especially when taken at higher doses or for extended periods. Some people notice difficulty concentrating. Others experience mood changes, restless sleep, or trouble remembering recent conversations. It can feel unsettling. Scientists believe part of the reason involves cortisol, the body's natural stress hormone. Corticosteroids are designed to act in a similar way. While they reduce harmful inflammation, they can also influence areas of the brain involved in learning, emotion, and memory, particularly a region called the hippocampus. Think of the hippocampus as your brain's memory librarian. Every day, it helps organize new experiences and decide which memories to keep and where to store them. When that system is under stress, the filing process may become less efficient. The information isn't necessarily gone, it just becomes harder to find. Recent research suggests that prolonged exposure to high levels of corticosteroids may contribute to temporary cognitive changes in some people. The risk depends on many factors, including the specific medication, the dose, how long it's used, and a person's overall health. That's why careful monitoring is so important. I remember a patient I'll call Susan. She was 73 and had been prescribed a high-dose steroid after a severe flare-up of an autoimmune condition. Within a couple of weeks, her husband noticed something unusual. Susan kept asking the same questions. She misplaced everyday items. She struggled to focus on television programs she had always enjoyed. She became frightened. Her family feared that dementia had appeared almost overnight. Fortunately, her specialist recognized that the medication itself could be contributing to these changes. As Susan's treatment progressed, her doctors carefully reduced the steroid dose when it was medically safe to do so, while continuing to control her underlying illness. Gradually, the mental fog began to lift. Her memory improved. So did her peace of mind. That story highlights an important truth. Not every memory problem is permanent. Sometimes the brain simply needs time to recover after the medication is adjusted appropriately. If you're taking corticosteroids, never stop them suddenly without medical supervision. Abruptly stopping these medications can be dangerous because your body needs time to resume producing its own natural steroids. Safety comes first. Instead, ask your healthcare provider questions like, how long will I need to take this medication? Am I on the lowest effective dose? What symptoms should I watch for that might suggest this medication is affecting my thinking or memory? Is there a plan to gradually reduce the dose when it's medically appropriate? Those conversations can make treatment both safer and more effective. The good news is that many people take corticosteroids for short periods and experience little or no lasting effect on memory. Even for those who do notice changes, the symptoms often improve after the medication is adjusted under a doctor's guidance. There is reason for optimism. But now we're entering the top three. And the next medication is one that millions of older adults take every single day, often without realizing it can quietly cloud the mind, especially when combined with other prescriptions. This is where the countdown becomes even more important. Number 3. Certain anti-anxiety medications. We've reached the top three, and this medication deserves your full attention because it doesn't just affect memory, it can also affect confidence. Medications commonly prescribed for anxiety, panic attacks, or insomnia, particularly a group known as benzodiazepines, have helped countless people through some of the most difficult moments of their lives. For someone experiencing overwhelming anxiety or severe panic, these medications can provide fast, meaningful relief. Their value is undeniable, but they were never intended to be the perfect long-term solution for everyone. Here's why. Your brain depends on a careful balance between activity and rest. One of the chemicals responsible for calming the brain is called GABA. Benzodiazepines strengthen the effects of GABA, helping quiet racing thoughts and promote relaxation. Think of GABA as your brain's brake pedal. When the brake is pressed too firmly for too long, everything begins to slow down. Not just anxiety. Memory, attention, and reaction time can slow down as well. For some older adults, the change is subtle. Conversations become harder to follow. Learning something new takes more effort. Names seem to disappear just when they're needed. Others notice they feel unusually sleepy during the day or unsteady when walking. These symptoms are easy to dismiss, but they matter. As we age, our brains become more sensitive to these medications, and our bodies often clear them more slowly. That means a dose that once felt perfectly normal may have a stronger effect years later. That's an important change. Research over many years has consistently shown that benzodiazepines can impair short-term memory and increase the risk of falls in older adults while the medication is active. Scientists have also investigated whether long-term use is associated with a higher risk of dementia. The findings have been mixed, and researchers continue to debate the exact relationship. Even so, many clinical guidelines recommend using these medications cautiously in older adults and reviewing them regularly with a healthcare provider. The goal is balance. I think of a patient I'll call George. He was 80 years old and had taken the same anti-anxiety medication every evening for nearly a decade. At first, it helped him sleep peacefully after losing his wife. But over the years, his daughter noticed something different. George repeated stories he had told only minutes earlier. He forgot appointments. He became hesitant to drive because he no longer trusted his concentration. He thought he was losing himself. When his physician reviewed his medications, they discussed whether the benefits still outweighed the risks. Together, they created a gradual plan that included other approaches to managing anxiety and improving sleep. The medication was adjusted slowly and carefully over time. Several months later, George told me something I'll never forget. "I still miss my wife every day," he said, "but I finally feel awake again." Those words stayed with me. His story wasn't about stopping a medication. It was about finding the treatment plan that fit the person he had become. If you take medication for anxiety or sleep, never stop it suddenly on your own. Doing so can cause serious withdrawal symptoms and, in some cases, can be dangerous. Any changes should always be made gradually, under medical supervision. Please remember that. Instead, consider asking your healthcare provider, do I still need this medication? Is this the lowest effective dose? Would another treatment or therapy be appropriate for me now? Sometimes the answer will be yes. Sometimes it will be no. But asking the question is the first step. The good news is that many people are able to manage anxiety successfully with a combination of carefully chosen medications, counseling, stress management techniques, regular physical activity, and healthy sleep habits. The right plan looks different for every individual. That's encouraging. And now we come to the final two. The next medication is taken by millions of people to relieve pain and muscle discomfort. Many assume it's harmless because it makes them feel better. But for some older adults, the price of that relief can be a mind that feels noticeably less clear. Number two is even more surprising. Number two, certain opioid pain medications. Pain changes everything. It steals sleep, it drains energy, it can make even the simplest day feel impossible. That's why opioid pain medications have an important place in medicine. After major surgery, a serious injury, or during cancer treatment, these medications can provide relief that nothing else can. Used appropriately and under careful medical supervision, they can dramatically improve quality of life. Their purpose is compassion, but they also require great care. Opioids work by attaching to special receptors in the brain and spinal cord, reducing the brain's perception of pain. Imagine turning down the volume on a loud alarm. The pain becomes quieter. But sometimes, so does everything else. Because these medications can also slow activity in parts of the brain responsible for attention, alertness, and memory. For some older adults, that may mean feeling unusually drowsy, having difficulty concentrating, or forgetting conversations that took place only hours earlier. The change can be subtle, or it can happen quickly. Older adults are particularly vulnerable because aging changes the way the body processes medications. Reduced kidney or liver function, combined with multiple prescriptions, can increase the likelihood of side effects. Even dehydration or an illness can make those effects more noticeable. That's why close monitoring matters. Recent research suggests that opioid medications can contribute to temporary confusion and cognitive impairment, particularly when treatment begins, when doses are increased, or when they are combined with other medications that cause drowsiness. The risk varies depending on the specific drug, the dose, the length of treatment, and the individual's overall health. There is no one-size-fits-all answer. I remember a patient I'll call Harold. He was 82 and recovering from hip replacement surgery. The operation had gone well, but a week later his daughter became deeply concerned. Harold seemed unusually forgetful. He struggled to remember what day it was. He repeated the same questions throughout the afternoon. She feared the surgery had triggered dementia. Fortunately, his medical team looked at the complete picture. They realized Harold was still taking a higher dose of opioid pain medication than he needed. As his pain improved, his doctors gradually adjusted his treatment plan, while introducing other pain management strategies that were appropriate for his recovery. Within days, the difference was remarkable. His conversations became clearer. His sense of humor returned. Most importantly, he recognized that he hadn't been losing his mind. His brain had simply been responding to a medication that was no longer the best fit for his stage of recovery. That brought enormous relief. If you're taking an opioid pain medication, don't suffer in silence if you notice changes in your thinking, and never increase or stop the medication without guidance from your healthcare provider. Instead, ask questions such as, is this still the right dose for my current level of pain? Can other pain management approaches help reduce my need for this medication? Are any of my other prescriptions increasing the risk of confusion or memory problems? Those conversations can help balance comfort with mental clarity. The good news is that pain can often be managed using a combination of treatments. Depending on the cause, physical therapy, gentle exercise, heat or cold therapy, topical medications, or non-opioid pain relievers may become part of a safer, long-term plan. Your healthcare provider can help determine what is most appropriate for your situation. You have options. And now we've reached the final medication, the one that surprises more patients than almost any other. Many people take it every single day. Many have taken it for years. Few ever suspect it could quietly interfere with memory. Number one changes everything. Number one, medications with strong anticholinergic effects. This is the one I wanted you to stay for. Not because it's the most dangerous medication, but because it's the most easily overlooked. Here's the surprise. It's not a single drug. It's an entire group of medications. Some are prescribed. Some are purchased over the counter. Some are taken for allergies. Others for bladder problems. Some for dizziness, nausea, muscle spasms, or even trouble sleeping. On their own, one medication may not cause noticeable problems. But together, that's where the story changes. Many of these medications share one important characteristic they have, what's known as anticholinergic effects. In simple terms, they block acetylcholine, the same brain chemical we've discussed several times throughout this video. And that's no coincidence. Acetylcholine is one of the brain's primary communication systems. Imagine it as the internet connection between billions of brain cells. Every time you remember a grandchild's birthday, follow a conversation, learn a new recipe, or recall where you parked your car, acetylcholine is helping those messages travel smoothly. Now imagine that internet connection becoming slower. Not disconnected, just slower. Messages take longer to arrive. Some never make it at all. That's what can happen when the overall anticholinergic burden becomes too high. The word burden is important. Many people don't take just one medication with anticholinergic properties. They take 3, 4, sometimes even more. Each one contributes a small effect. Individually, those effects may seem insignificant, but together, they can add up, especially in older adults whose brains are naturally more sensitive to changes in these chemical signals. This is something many people never hear about. Over the past decade, researchers have become increasingly interested in what is called the cumulative anticholinergic burden. Multiple studies have suggested that a higher cumulative exposure to these medications is associated with poorer memory, slower thinking, an increased risk of falls, and, in some studies, a higher likelihood of cognitive decline. While scientists continue to investigate exactly how strong this relationship is, many geriatric specialists now recommend reviewing a person's entire medication list rather than looking at each prescription in isolation. That's a major shift. Instead of asking, "Is this medication causing my memory problem?" doctors are increasingly asking, "What is the combined effect of everything this person is taking?" That question can change everything. I think of a patient I'll call Eleanor. She was 84. She lived independently. She balanced her own checkbook. She drove herself to church every Sunday. Then, little by little, things began to change. She forgot to pay a utility bill. She misplaced her house keys twice in 1 week. She repeated stories during family dinners. Her children quietly began discussing assisted living. Everyone assumed the same thing: dementia. But Eleanor's physician wasn't satisfied with assumptions. Instead of focusing only on brain scans and memory tests, he carefully reviewed every medication she was taking: an older allergy medicine, a bladder medication, a sleep aid she bought without a prescription, a medication for occasional dizziness. Individually, none seemed alarming. Together, they created a significant anticholinergic burden. Her healthcare team carefully evaluated each medication. Some were no longer necessary. Others were replaced with alternatives that were less likely to affect cognition. A few remained because their benefits clearly outweighed the risks. The changes were gradual. So were the results. Several months later, Eleanor wasn't a different person. She was herself again. She laughed more. She followed conversations with ease. She felt confident driving to church. Her children noticed the difference before she did. And while aging continued as it does for all of us, her frightening decline had slowed enough to preserve something priceless: her independence. That story has stayed with me for years, because it reminds us that good medicine isn't simply about adding prescriptions. Sometimes it's about carefully reviewing them. If you're over 60 and taking several medications, ask your healthcare provider or pharmacist if it's time for a comprehensive medication review, not just one prescription, all of them. You might ask, could my medications be creating a high anticholinergic burden? Are there safer alternatives for any of these? Do I still need every medication I'm taking? Those 3 questions could start one of the most valuable conversations you'll ever have about your health. Please remember this: never stop a prescription medication on your own. Many of these medicines are essential and may be protecting your heart, your lungs, your kidneys, or your overall health. Any changes should always be made together with the healthcare professional who knows your medical history. That's the safest path. The good news is that memory changes are not always a one-way street. Sometimes they're caused by a combination of factors that can be identified, addressed, and improved. The earlier those conversations happen, the more opportunities you and your healthcare team have to protect both your health and your independence. And that is the message I hope you remember long after this video ends. If there's one message I hope stays with you today, it's this: memory loss is not always inevitable, and it's not always irreversible. Sometimes, the first step isn't finding a new medication. It's taking a fresh look at the ones you're already taking. I've seen patients regain confidence after nothing more dramatic than a thoughtful medication review. I've also seen families breathe a sigh of relief when they discovered there was more than one possible explanation for memory changes. That hope is real. So, if you noticed yourself in today's video, or perhaps you were thinking about a spouse, a parent, or a close friend, don't ignore those concerns. Write down your questions. Gather all of your medications, including over-the-counter products, vitamins, and herbal supplements. Then, schedule a conversation with your healthcare provider or pharmacist, not out of fear, out of wisdom. Because the goal isn't simply to live longer, it's to stay independent, to remain mentally sharp, to continue recognizing the faces you love, to keep enjoying the life you've worked so hard to build. Those moments are worth protecting. If you found this video helpful, please take a moment to tap the like button. It helps us reach more older adults and families who may be searching for answers but don't yet know where to look. And if you're not already part of our community, consider subscribing. Every week, we explore practical, research-based strategies to help you protect your brain, strengthen your body, and live with greater confidence as you age. We're just getting started. Before you go, I'd love to hear from you. Which medication on today's list surprised you the most? Or have you ever noticed your memory improve after talking with your doctor about your medications? Share your experience in the comments. Your story could encourage someone else to ask the question that changes their life. Finally, here's one more thought to leave you with. Many people watch for wrinkles. Others watch the number on the scale. But one of the earliest clues about your future health may be hiding somewhere you rarely think to look. Your hands, the shape of your fingernails, the strength of your grip, even the way your fingers change over time may reveal important clues about your heart, your circulation, your nutrition, and even your brain. What they reveal may surprise you. I'll show you in the next video.